Come here, your what is asleep?
My feet are asleep.
Come here for a sec. I want to ask you a question. Malaya, you know what the word of the day is? Turn around. Come here. Come here for a sec. I want to tell you the word of the day. So, the word of the day is hypothalamus. Say hypothalamus.
No.
Say hypothalamus.
Hydrate.
No, hypothalamus.
Hydrate.
Say thalamus. Hypothalamus.
Hypothalamus.
There you go, you did it. And use it in a sentence. Can you use it in a sentence?
I can.
You can't? Okay, here's the sentence. Okay, ready? When Malaya goes to the zoo, she checks out the hypothalamus.
I did it!
Wait, I think you're supposed to say hippopotamus.
Hippopotamus.
Hypothalamus.
Hypothalamus.
Good job. Hello there. Hey guys. How's everybody doing? I hope you guys are doing okay. It's been a while. And the reason why it's been a while is because there's this force that's been taking over my life. The author Stephen Pressfield actually called it the resistance, la resistance. Well, it's sad to say it's procrastination, guys. I'm sorry. I mean, I've been really busy with a lot of things, having 4-year-old. She's 4-year-old now. And of course, work and a lot of things going on. But today, I want to spend some time with you guys and I want to talk about procrastination. And also, of course, we're going to go over a few reviews. Okay? Now, guys, procrastination is a trap that many of us fall into. Okay? In fact, according to plenty of researchers, 95% of us, to some degree, actually procrastinate. And while it may be comforting, right, to know that you're not alone, that everybody's doing this, well, it's important to realize that just how much it can take over your life and hold you back. Okay? So, in this video, we're going to look at why it happens. We're going to explore strategies for managing and prioritizing your workload and also your time and your life more efficiently. Okay? Procrastination is an active process, right? You choose to do something else instead of the task that you should or you're supposed to be doing, right? So if we procrastinate over a long period of time, we can become demotivated and disillusioned with the work, which can lead to depression and even more procrastination. Now, as with most habits, it's possible to overcome procrastination, okay? Now, here are the steps. Step one, recognize that you are procrastinating, right? Now, you might be putting off a task because you had to reprioritize your workload, but if you start to put things off indefinitely or switch focus because you want to avoid something, then you probably are procrastinating. So go ahead and tell yourself and own it. Tell yourself, here I am avoiding my task and watching an episode or a few episodes of Netflix. And I'm procrastinating and I'm owning it. So, first, you got to recognize and own it. Step two, work out why you're procrastinating. Okay? You need to understand the reasons why you're procrastinating before you can begin to tackle it, right? For instance, you're avoiding a particular task because you find it boring or unpleasant, right? Or hard. Again, be mindful of this and start to analyze this reason. Now, usually these reasons can be you know, poor organization, right, can lead to procrastination. Understand that organized people successfully overcome procrastination because they use prioritized to-do lists, right, and they create effective schedules. Understand that these tools can help you organize your tasks, okay, by priority and having deadlines, okay. Now, sometimes even if you are organized, you can still feel overwhelmed by a task. Perhaps you have doubts about your ability, worried about failing, so you put it off and seek comfort in doing other things, right? Some people fear success as much as failure, right? Also, another major cause of procrastination is poor decision making, right? If you can't decide what to do, then you're going to likely put off taking action, right? In case you're going to do the wrong thing. So, again, try to analyze why you are procrastinating. And third, okay, and this is the most important step, is then you're going to adopt anti procrastination strategies. Okay, now we're going to take action. So understand that procrastination is a habit. It's deeply ingrained pattern in a lot of our behavior, and this means that you cannot probably do it overnight. Okay, so therefore you need to adapt to as much strategies as you need. Um, Now, these are the anti-procrastination strategies that I would suggest for you to do. Okay. Now, first, commit to the task. You gotta focus. You gotta focus in doing it, not avoiding it. Write it down. Write the task down that you need to complete, and specify a time for doing and finishing it. Okay. Next, you're gonna promise yourself a reward. Right. Everybody needs a motivation, so you're gonna reward yourself if you completed a difficult task on time. Reward yourself with a treat, maybe a slice of cake, some coffee in your favorite coffee shop, maybe an episode of Netflix. Okay? Now, another thing is that you can ask someone to check up on you, right? Peer pressure works, accountability works. Okay? This is the principle behind self help groups, right? And if you don't have anyone to ask, well, there's online tools or apps that can help you self monitor yourself. Okay? Having goals. Self monitor those goals. Lastly, act as you go. Basically, take action right now, not in the next 5 minutes, not in the next 2 minutes, but right now. Tackle the tasks as soon as they arise, rather than letting them build up. Okay? Now, lastly, I know I said that was the last one, but lastly, you got to minimize distractions. This is very important, guys. Minimize distractions. Put your phone away, turn off your email, turn off social media, and aim to eat the elephant first thing every day. Okay? First thing every day, get those tasks that you find the least pleasant out of the way early as you can. This will give you the rest of the day to concentrate on work and other things that you find more enjoyable. Okay? So that's it, guys. I hope you find those tips helpful and valuable. And now, I just want to keep it short and sweet. Now we're going to go on to our review. Hello, ladies and gents. How's everybody doing? I hope you guys are doing well. So you can see I'm in a beautiful park, in a beautiful sunny day, a few clouds here and there. But I brought my notes with me because we're going to be talking about one of the most important topics that you might encounter in your NCLEX exam, and that would be Meistenia Gravis, right? So you all know, Meistenia Gravis is a progressive neuromuscular disease, right? And there's basically a decrease in acetylcholine levels, which is basically opposite of the Parkinson's disease, right? And you're going to see a lot of weakness in the skeletal muscles. It's an autoimmune disease, and it's also more common in women than in men. So what manifestations we might see in the patient? Obviously, we're going to see some muscle fatigue, some ptosis, which is basically drooping of the eyelids, right? And there's going to be difficulty chewing or swallowing, right? Because it also affects the lingual and the neck muscles, right? Now, a couple of things I want to talk about would be Meistenia crisis or Stenec crisis and cholinergic crisis, right? So with Meistenia crisis, there's basically too little medication given to the patient, right? And what occurs is that there's just going to be an exacerbation of the symptoms, right? And as we mentioned before, some of the symptoms can include ptosis, some difficulty swallowing, dyspnea, and weakness, right? So this weakness it's not just fatigue, but it's more of a muscle weakness in the patient. Let's look over again, go over some of the assessment, which includes dysphagia, drooling, diplopia, ptosis, and impaired speech. And like I mentioned before, fatigue, right? And what you need to take note would be for respiratory distress, okay, because we do want to be mindful about the airways. So respiratory distress would be an important assessment that we need to be aware about. Now, going back to cholinergic crisis, what occurs is we're basically giving the patient too much of the medication, right? And again, there's going to be almost very similar exacerbation of symptoms, right? Increase in muscle weakness, dyspnea, salivation, but there's also going to be some sweating and some nausea and vomiting, okay? Now, usually, non-pharmacologically, we can give our patient a high-calorie diet and also a procedure of plasmapheresis, okay? A non-invasive procedure. Pharmacologically, what can we give our patients? So there's 3 categories of drugs that we can be used as drug therapy for a patient with Meistenia Gravis, and that can include glucocorticoids, anticholinesterase inhibitors, and immunosuppressants, okay? With glucocorticoids, it includes prednisone, dexamethasone, and corticotropin, all right? Now, let's look at anticholinesterase inhibitors, right? Or which are basically cholinergic medications. And the 2 most common drugs that you might encounter would be neostigmine, which is prostigmine, and pyridostigmine, which is Meistenia. Okay. So, I'm sorry about that, guys, and I'm very sorry for any noises in the background. I'll try my best to maintain not have a noisy background. So, with specifically with neostigmine and pyridostigmine, right? Those are very important cholinergic medications for a patient with Meistenia Gravis. Side effects can include increased in GI motility, can also have some bradycardia, and increased salivation, okay? Now, lastly, we're going to look at immunosuppressants, right? And the main drug for that would be cyclophosphamide or cyclosan. And it's basically a chemotherapy drug, right? But it also helps alleviate the symptoms and the fatigue from that occurs in patients with Meistenia Gravis. Okay, so side effects of cyclosan can include nausea and vomiting, loss of appetite, and diarrhea. Okay, now we're going to talk about diagnosing our patient with Meistenia Gravis. So, also, guys, I want to go back to anticholinesterase inhibitors, right? Which is neostigmine and pyridostigmine. What it does is basically destroys the acetylcholinesterase that breaks down ACH, right? And as you all know, ACH helps with muscle contraction. Therefore, it helps with the weakness and helps with the muscle tone in our patients with Meistenia Gravis. Okay, so